This video will introduce you to the potent benzodiazepine known as alprazolam, which is its generic name. You might be more familiar with this drug if you think of its trade name, which is Xanax. Xanax is a drug that's used to treat anxiety, panic attacks like those that occur in agoraphobia, or chemotherapy-related nausea. Some of the side effects associated with Xanax are confusion, rash, hallucinations, jaundice of the skin and eyes, and other more minor related side effects. But the biggest thing you have to worry about with its use is chemical dependency. Xanax is a drug that's abused and used recreationally, and a patient who uses it on a long-term basis can develop a chemical dependency. The way that Xanax works is through the Gaba Receptor complex, seen here in a plasma cell membrane. Now, GABA, as you probably know, is the most potent inhibitory neurotransmitter in our nervous system. And it works through a GABA receptor, which is essentially a chloride ion transport channel located in your cell membranes, as I said. 5 GABA receptors work together in one GABA receptor complex inside that cell membrane. Now, GABA, which is a neurotransmitter, normally binds to a binding site on this receptor complex and then allows chloride ions to enter the cell, thus hyperpolarizing the membrane and causing an inhibitory mechanism to occur whereby no action potentials occur, or none of that anxiety, none of that panic attack is going to happen because these neurons are shut down. How Xanax works is it's a positive allosteric modulator, which means that when it binds, this receptor complex is going to undergo a conformational change whereby GABA wants to bind much more often and much more strongly to this receptor complex. And like I said earlier, once GABA does bind, chloride ions float inside the cell, thus hyperpolarizing the membrane. Some key features of this process are the suppression of the hypothalamic pituitary axis, which is going to shut down your body's stress, and this GABA inhibition. That's going to be the key word, GABA inhibition, which is going to shut down the neurons, preventing the anxiety, preventing the panic, and that's how this drug works. Whereby GABA wants to bind much more often and much more strongly to this receptor complex. And like I said earlier, once GABA does bind, chloride ions float inside the cell, thus hyperpolarizing the membrane. Some key features of this process are the suppression of the hypothalamic pituitary axis, which is going to shut down your body's stress, and this GABA inhibition. That's going to be the key buzzword, GABA inhibition, which is going to shut down the neurons